like a foreign body. Suppose I remember one patient had a bronchiectasis, um, and one child actually bronchiectasis, and he was having continuous cough, repeated consultations, so could not reveal in diagnosis. But ultimately, when they did a bronchoscopy, they found a small foreign body, some peanut or some rotten something. So it was a foreign body. So foreign body aspiration into the one of the airways also will cause obstruction, and the segment that are the distal to the obstruction will develop bronchiectasis changes, and this will invite infection, pus formation, and all those things. So obstructive pathology also can cause bronchiectasis, like tumors. Suppose somebody has a bronchogenic carcinoma or a lymphoma, the mediastinal lymph nodes pressing one of the airways from the outside. The external compression of the airway also will cause the distal bronchiectasis changes. So these are the mechanical causes. And we have any lymphadenopathy, even tuberculosis or in lymphomas, any malignancies, compression from outside. And sometimes aspiration pneumonia, patients who are in altered sensorium, they're aspirating repeatedly, they're on bedridden, they're patients like hemiplegia patients who are bedridden, on rise to feeding, they cannot swallow, they recurrently aspirate. These people are at a higher risk of developing the bronchiectasis. And toxic gas inhalation, they say the people working in big gas factories, if they go on inhaling, so that will damage the airways and cause bronchiectasis. And most importantly, there's some group of systemic diseases also which are prone to develop bronchiectasis. In systemic diseases, we have connective tissue disorders. Importantly, connective tissue disorders can cause bronchiectasis, like your SLE, Sjogren's syndrome. We call it as Sjogren's. It is not called Sjogren's, though it is J. We call it as Sjogren's syndrome. Sjogren's syndrome, SLE, and systemic sclerosis. Systemic sclerosis also is one of the connective tissue disorders which can cause bronchiectasis in some people. Then we have a very miscellaneous number like Marfan syndrome and all those things. These are the causes of bronchiectasis. So, so what will happen in the bronchiectasis? When there's a damage to the airway, there's a loss of epithelium, loss of cilia. Normal airway should have healthy epithelium, healthy cilia. The cilia can function only when the epithelium is good, and the epithelium can function only when the cilia is good. So here both are damaged, and there are some holes in the ciliary epithelial cell which release the cytokines. As long as the cytokines, the inflammatory markers are released. So one is the inflammatory markers released by the external insult like bacteria, fungus, and virus. Second, our own body cells like mast cells, neutrophils, eosinophils, they produce their own eosinophil when they are damaged, when they are broken, when they are distorted. So everything is a big inflammatory cascade goes on in the walls of the airways, and then they cause continuous damage to the airways. So therefore, this damage is a permanent one. This damage is a permanent one. Though there is a dilatation, the patient will come with features suggestive of constriction. That is the important thing. There is a constriction because it's not moving. The normal elasticity, there's a cartilage damage of the cartilage. The upper airways will have cartilaginous rings. They help in dilatation and constriction. Dilatation when you're breathing in and breathing out. This cartilage also is damaged, and ultimately it results in there is a stiff part, there's a tube. So this will act as a bronchoconstriction. A patient will have a breathlessness. So that is the main pathology. And these changes that we are talking can be localized to one particular area or can be generalized. It can be localized to one particular area or generalized. If suppose there is some foreign body, or suppose there is a tumor in the lower part of the lungs, so one particular airway is obstructed, only you develop bronchiectasis there. The remaining part of the lung may be normal. But if you are dealing with a systemic diseases, it can be bilateral, it can be widespread. Because there is no cure, the prognosis is very bad. Though we have treatment, but there is no cure. It's a gradually progressing disease. So what are the signs and symptoms? Signs and what do the patients come to you with? Patients will come to you with same thing. Most of the respiratory diseases, that's the difficult part of respiratory system. Most of the, even if it's tuberculosis, pneumonia, asthma, bronchiectasis, COPD, they're only fever, cough, breathlessness, sputum. Fever, cough, breathlessness, sputum. So these are the only major, or chest pain, sometimes hemoptysis. So bronchiectasis patient can come with fever if it is infected, and they can come with breathlessness. They can come with cough and copious amount of sputum production, because the dilated airways will get pulled up with the abnormal amount of mucus, foul smelling mucus secretion. So it becomes pus. So when they bring out the sputum they say it is a foul smelling sputum, especially if it is a pseudomonas infection, or when it is a anaerobic infection. The foul smelling is because of mainly these two bugs. So therefore, anybody complaining of the greenish yellow sputum, foul smelling, you suspect these are the causative organisms like Pseudomonas. Though Staphylococcus also can cause pus, but Staphylococcus usually doesn't stink. Okay, so bronchiectasis can also, the patients can also present with the hemoptysis. They can also come with, if there's a small rupture of any vessel, the sputum may be blood tinged and they may vomit frank blood sometimes, so much that they may have to be given blood transfusion and all. So those are the signs and symptoms. Those are the complaints that patient can come to you with. So if you take proper history of the patients, they may give a clue towards what is the probable death. They may say that, yes, I had TB 6 months back, or I had pneumonia a few weeks back, or some other infection like that. So that is the complaints. So what are the signs when you examine the patient? How do you diagnose? It's very difficult to diagnose the bronchiectasis basing on only clinical examination, but there are some hints, there are some clues you can suspect. You've heard of